He will join us. So niendelee. Ladies and gentlemen, I'm called Austin Oduor Otieno. I'm the president of the Global Association of Clinical Officers and Physician Associates. Today, we have this short session where we are going to talk about Gacopa, how it was formed, its history, and then we will tell members about the upcoming International Delegates and Scientific Conference that is set to take place in the beautiful city of Gaborone, Botswana. Most of the time I'll be reading some of the details that I have, but in summary, I want to read a short statement that was released on 1st May 2024. This was a statement from the Office of the President, and it was an update about the upcoming conference. That is the 4th International Conference that will take place in Gaborone, Botswana. And the statement reads, "We are excited to announce the 4th International Delegates Scientific Conference, which will take place from August 26th to 29th at the DDT College of Medicine in Gaborone, Botswana. This conference will focus on the theme, universalizing the practice of clinical officers, stroke physician associates, stroke doctor assistants, etc., a global synergizer for healthcare excellence." That is the main theme for the conference that we'll be having in Botswana. And the main objective of the conference is to discuss the latest advancements, challenges, and best practices in the field of clinical officership and physician associate practice. Attendees will have the opportunity to share knowledge, experiences, and innovative approaches to enhance the quality and effectiveness of clinical officer physician associate practices. Additionally, the conference will explore strategies for standardization and universalization of the COPA training. When I talk of COPA, that's clinical officers, physician associates, and analogs. Analogs means those other titles. We have several titles. And this will help in fostering collaboration and networking among COPAs and advocating for recognition and integration of COPAs. Recognition and integration, that is what Gacopa is always doing with our East African chapter. The East African Vice Chair will be here shortly, and we'll talk about that. The conference will feature 5 sub-themes, including advancing the role of COs, PAs in primary care, standardizing training and certification process for COs, PAs, integrating COs and PAs into interprofessional healthcare teams, enhancing scope of practice and regulatory framework for COs and PAs worldwide, and promoting equity and access in healthcare through COPA. The last conference took place in Malaysia, and it was graced by the Minister of Health, Malaysia, the Honorable Zaleha Mustafa. The abstract submission for the conference will open during the first week of May. It should open, and guidelines will be issued by the scientific committee. During the conference, we'll have 3 awards. This should be taken very seriously. 3 awards. The Outstanding Clinical Practitioner for the year 2023-2024. In Rwanda, the Outstanding Clinical Practitioner of the Year was Fitsum Tae Negash from Ethiopia. And our last conference, that is last year, it went to Mohammed from Malaysia. Then there is the Best Award in Excellence and Leadership. It was introduced in Malaysia, and it's also known as the Minister for Health Award. We will also have it in Botswana. The occupant of that award is Phyllis Kemunto Onkoba from Kenya. And we'll have a new award called the Gacopa President's Award to an Outstanding Clinical Practitioner. That will be at the discretion of the President to select. Though we will have the selection committee. The DDT College of Medicine, that's a private university in Botswana that only trains the doctor assistants, our equivalent, will host this conference. So the conference will take place at the DDT College of Medicine, a very, very outstanding university that trains medical practitioners. And together with the Botswana Clinical Officers Union, led by Uyapo Maweni and Thabo, and the local organizing committee are working diligently to make this conference the best ever in the history of our profession. We need to have more people. Last time we had 200 international attendees in Malaysia. This time it should be more. The conference fee will be US dollars 200 for clinical practitioners, and the clinical practitioners are the ones that I've mentioned, and 250 US dollars for non-clinical practitioners. An online attendance option will be available for a fee of 50 US dollars. That is our team, the technical team and the IT team is working on that. There will be a gala dinner hosted by the DDT College of Medicine and a site visit. Botswana is ready to host us, and we look forward to experiencing the vibrant culture of this Southern African nation. We will share travel and stay logistics in the course of this engagement. So this letter was signed by the president of Gacopa on Wednesday, 1st May 2024. Now, back to Gacopa, as we will finalize the issues of the conference. Gacopa was formed in 2018. And how was it formed? In summary, the Global Association of Clinical Officers and Physician Associates was formed by like-minded clinical officers, physician associates. Actually, it began with the formation of the East Africa Association of Clinical Officers under the guidance of Norman Wagaba, and there was Innocent Somboi from Tanzania, and there was someone from Rwanda, and then there was a team from Kenya. So when they decided that they had to form the East Africa Association of Clinical Officers, they got their counterparts from West Africa, led by Anthony Ako, Theophilus Ampai from Liberia. Anthony Ako is from Ghana. And we also had Joel Paddy from Ghana. And we also had from Sierra Leone and a team from Nigeria. So these people teamed up with the team from South Africa. And they decided that they should form the Africa Association of Clinical Officers and Physician Associates, ACOPA. So a meeting was arranged. It was virtual meetings. 2 to 3 meetings were arranged. And we got support from the Physician Assistant for Global Health that was based in New York that said, let us have it international. So they joined us. And when we realized that there are also other countries that offer this, have got this kind of training or this kind of officers, Papua New Guinea joined under Maluo Maguru, the president. So it could now not be Africa Association of Clinical Officers and Physician Associates. It had to be now the Global Association of Clinical Officers and Physician Associates. So it was registered in Accra, Ghana, and the registration number is CG261-482-2018. So in 2018, December 27, Gacopa was born officially with a registration certificate. And its headquarters being in Ghana, it has grown now to cover almost 30 countries from the initial 16. So discussions in forming it finally bore fruit in that 2018 that I'm saying. And the clinical officers who are the core of its membership exist with different names in the world. Gacopa works to bring them together. They form a core group of clinicians who have been the backbone of healthcare in numerous countries. They, however, lacked WHO recognition and a common nomenclature. Gacopa now brings together this critical mass to ensure they garner the recognition for their valuable inputs to the health system. Now, following the registration of this international body on 27th of December 2018, a vibrant team that got elected began serious sensitization with the second international conference in sight, and it was supposed to take place in Rwanda. So in 2018, after the election where I was elected as the president of the association, I will read the list of the other officials, but then we held our first meeting in Ghana, which was a mini conference, and it was graced by the then Minister for Greater Accra region, and very many people from Ghana attended. There was a delegation from Kenya, there's a delegation from Malawi. I can remember in Malawi, Aubrey Philemon, Aubrey Philemon attended the conference together with his team from Malawi. There was a team from South Africa. There was a team from East Africa, Uganda, and etc. Then from there, before we held our second conference in Rwanda, we held some key meetings. We visited Rwanda, we visited Uganda, and we also tried and visited Ghana just to sensitize our people about this conference. So the current leadership, I'm welcomed here by the Vice Chair of Gacopa East Africa. He will get his time and he will talk about the East African chapter. Thank you, Mr. Godfrey. So the International Executive Council of Gacopa, the president is I, Austin Oduor from Kenya. The first vice president is Anthony Asare Akor from Ghana. The second vice president is Theophilus Ampai from Liberia. The third vice president is Laurent Gabo Tete. Tete from one of the key guests when we'll be holding our 4th international conference in Gaborone, Botswana. The Secretary General is Joel T. Padi from Ghana with his 2 deputies. That is Patience Sleke of Liberia and Raymond Mobu of Ghana. The organizing director is Chris Onditi from Kenya, who is doing the organization and is part of what we are now doing here. The deputy director, the director of communication is Viola Mujukizi from Uganda, while the deputy director of organizing director is Annette Kara from Uganda. The deputy director of communication is Solomon David Chomba, that's the president of the Malawi PAUM, and the director of finance is Emmanuel Dixon Tafor. The deputy director of finance is Rosalind Akot from Kenya. The gender secretary is Sharon Whitney from Australia. We have the deputy gender secretary from India, and we have the directors at large. The director of Africa is Ken Ochogia, and director at large Asia is Mustafa. We also have the board, where we have a team that heads the board, where we have Charles Saban. Bishop Charles Saban is the chairman, and there is a professor, I've just forgotten the name, sorry. So we say that our first international conference that took place in Ghana, that was the first meeting that we as Gacopa held, and a young Gacopa trying to find its footing with various leaders spread across the continent, tasked to meet in Accra, Ghana for the inaugural conference. The event was organized by the Graduate Physician Assistant Association of Ghana, and it took place at the University of Professional Studies in Accra, Ghana. The chief guest was the Deputy Minister for Greater Accra and Accra region. At being the first event and the first physical meeting between the leaders who have been engaging online for close to 3 years by then, a lot of engagements followed. Key delegation at that time was led by the Director of Clinical Services who came from Kenya, the then Registrar of the Clinical Officers Council of Kenya, Mutinda Kisingu, other clinical officers. Rwanda was represented by the Registrar of the Rwanda Allied Health, and there was a delegation from Sierra Leone, Liberia, South Africa, Uganda, Malawi, and they were present throughout. So that's how our first conference went. That meeting, which was very successful, created room for negotiation with the government, and it's really helped us so much when we held that conference. The theme of that conference at that time in Ghana was the role of interprofessional and interregional collaboration. And on September 14, 2019, after an executive council meeting, Kigali, Rwanda was named to host the second Gacopa International Conference. And it was a very, very nice decision. This announcement came weeks after a delegation led by the president of Gacopa had visited the University of Rwanda. June 9, 2019, a team led by the president visited Uganda, where they were hosted by the medical clinical officers professionals of Uganda. And the representatives from the Uganda Allied Health Council presented a citation of honor. So when we held our conference in Ghana, we had a citation of honors where we were giving to countries that attended the conference, our first inaugural conference in Ghana. So when the Uganda team presented, asked us to join them in Uganda, where they were presenting the citation of honor to the government of Uganda, it was received by the Director of Clinical Services, Dr. Charles Olara. And when it came May 15, 2019, The Gacopa second Vice President Theophilus Amfaye also presented the citation of honor to the then Minister for Health, Dr. Wilhelmina Jala in Monrovia. And May 3rd, 2019, the Malawi team that attended the conference also presented their citation of honor to the government of Malawi. This was presented by Solomon Chomba to the Director of Clinical Services, Chitope Mwale. Now, after the first conference in Ghana, we held our second conference, International Delegates Conference, in Kigali, Rwanda. We were now a bit mature. We were now maturing up. And the second conference was now the start of everything. And at least now, the engagement had begun. This conference was received with a lot of enthusiasm, and it was well attended, attracting an international delegation of more than 140 spread across the world. A breakdown of the delegates saw Kenya send 79, United States 15, Ghana 9, Malaysia 7, Uganda 14, South Africa 3, Zambia 3, Sierra Leone, Liberia, and Tanzania 2 each, with Malawi, Ethiopia, and UK 1 each. This is the conference that saw the grand introduction of Malaysia, who accepted to host the third international conference. The Malaysia team that was led by Zulhemi bin Abdullah later on hosted the Gacopa president and his team when they celebrated the Malaysia Medical Assistance Day. The conference took place at the University of Rwanda main campus conference hall in Gikondo. They call it Chikondo. Prior to this meeting, we had held several meetings with Rwanda and the Ministry of Health and the University of Rwanda, who were the host. The conference came at a time when the government of Rwanda, through the University of Rwanda, ordered for the stopping of the training of clinical officers. This meeting, which was very successful, created room for further negotiations with the government, with a reversal of the earlier decision to scrap the clinical medicine course by the then Prime Minister, which was painting a ray of hope for the students and the profession at large. The theme of that conference in Rwanda was maximizing the impact of clinical officers and physician associates, a strategy for achieving universal health coverage. The Outstanding Clinical Practitioner of the Year award, as I stated earlier, was awarded to Fitsum Tai Negash from Ethiopia. The George Washington University, led by Professor Lisa Alexander Mustone, the National Certification of Physician Assistant, led by Morton Rice, and the Physician Assistant Educators Association, led by, together with EAPI, supported this big event. This was necessitated by the Ministry of Health, Rwanda, the University of Rwanda, and the Rwanda Medical Clinical Officers Organization, not failing to mention the student body of the association. After that conference, we planned now for the third international conference that took place between June 18th to 21st, that was last year, 2023 in Malaysia. And the specific objective of the third international conference were to promote knowledge as an important driver and foster dialogue. The theme for the conference was the theme for the conference was the one in Malaysia, also just tailored about harmonization. And the organization expected 300 delegates, but it was more. So we feel the conference in Malaysia was well attended, and it was graced by the Minister for Health Malaysia, just as stated, and it was one of the best conferences so far for the global body, for Gacopa, and we thank that. So when it comes to the activities of Gacopa, what we've done so far, we visited Malaysia in March 14, 2020, just as I'd stated earlier, and that Gacopa team that also had the Kenya Union of Clinical Officers General Secretary George Gibore, Nairobi Branch Secretary Tommy Shira, and the founding Gacopa executive Angelina Macedo attended that meeting in Malaysia prior to the conference that took place. Then again, we also visited the Parliament of Malawi, June 22nd, 2021. We keep pushing for recognition by our members and affiliates. The delegation of Gacopa set foot in Malawi Parliament, where the Gacopa president held a consultative meeting with the Malawi First Deputy Speaker, the Right Honorable Madaliso Kazombo, at his offices in Parliament buildings. We presented to the Speaker the Registration Licensing Act 20 of Kenya, which we also held a meeting with the fellow clinical officers who are MPs, Honorable Sabel Kafwafwa, and who was the MP for Desert North, and Salima Northwest counterpart Enoch Fale Genasi, now Assistant Minister for Health. April 6th, 2022, we visit Zimbabwe. And the most funny thing about Zimbabwe they only have around 200 clinical officers, and these clinical officers did not know that they are also clinical officers outside Zimbabwe. And there were nurses who were upgrading to become clinical officers. We met with their leadership, and our visit in Zimbabwe has really propelled a lot of things. And even as we speak now, on 16th, that is tomorrow, the Clinical Officers Association of Zimbabwe will be meeting the Health Service Commission there, and just to ensure that they are recognized and even the training is harmonized. And we will be visiting Zimbabwe as we head to Botswana during the conference. Together with the leadership of the Zimbabwe Clinical Officers Association, we visited Parliament, where we held consultative engagements with the Committee of Health of Parliament of Zimbabwe. After that meeting, remember, in our conference in Malaysia, the team of Zimbabwe came, including the parliamentarians. The committee that was chaired by Honorable Ruth Labode acknowledged the presence of Gacopa and its work across the globe, praising the work done by Clinical Officers Board. The committee acknowledged the need to have training of clinical officers reintroduced and the need to have more of the cadres in Zimbabwe. She said this will ensure effective management of emergencies at the rural areas and effective referral. We were also accompanied by the Vice President of the Nigeria Society of Community Health Practitioners, and that was Dr. David. David was also there. Then the clinical officers in Zimbabwe need to have the necessary parliamentary backing, and we are trying to do that. Also present was the president of the Zimbabwe Clinical Officers Association, Estimate Katumwa. Clinical officers training in Zimbabwe began in 1975 at Mpilo Hospital. After that, we visited Zanzibar, April 25th, 2022. The Ministry of Health of the Revolutionary Government of Zanzibar, together with the House of Representatives, agreed to Gacopa request to hold the East Africa Inaugural Conference. And he will be talking about that East Africa first conference that took place in Zanzibar. But our visit to Zanzibar on April 25th hatched that plot to have that conference. And the Gacopa executives were led by the president. They had an exclusive meeting with the House of Representative Welfare Committee. The meeting, which took place at the Parliament building in Chukwani, was also attended by the Ministry of Health, Director of Curative Services, Dr. Salmin Amor. In the meeting, which was chaired by the committee's head, attended by members Honorable Zawadi Amor Nasur, Abdallah Awasi, and Honorable Bihinda Amid Kamis, among others, discussed issues relating to the role that clinical officers in that country play. And it is them that even pushed that we have the East Africa first meeting, where we went to Yala, and through them they pushed it because they really wanted that harmonization. So that is where the harmonization issue began. They also agreed to engage the East Africa, the Yala MPs, and a request by Gacopa president to have Zanzibar host the inaugural East Africa Clinical Officers Conference was both supported by the Assembly and the Ministry of Health. On their part, both the government and Assembly assured Gacopa of a good working relationship. Also present were the Burundi Clinical Officers Association, Secretary General Jean-Claude Gendakumana, Tanzania Association of Clinical Officers and Clinical Assistant Innocent Somboi, Gacopa Organizing Director Chris Onditi, Director of Communications Viola Muchukizi, and Emmanuel Agom of Uganda, Medical Clinical Officers Association. After that, now we set foot in Arusha, the heart of the East African Legislative Assembly, May 28th, following that meeting in Zanzibar. The East African Parliament okayed the establishment of a joint regulatory body for the clinical officers in the region. A meeting between the Parliament Committee dealing with health and the leadership of Gacopa revealed that development. So members of Gacopa held that consultative meeting. It was chaired by Honorable Dennis Namara, MP, and discussed on how a joint regulatory body for clinical officers can be initiated. Namara, who is also the chairman for the General Purposes Committee, also handled that issue. And we can report, and he will talk about that the East Africa Clinical Officers Harmonization document and framework is already at its final stage, where it's at the Council of Ministers for Health, where it is set for adoption. So those proposals to engage the Health Department and the Secretariat were discussed there. And the meeting again was attended by the Burundi Clinical Officers Association Secretary, Jean-Claude, his Ugandan counterpart, Alex Kachwano, Medical Clinical Officers Professional, Paul Kiateka, and Takoka President and executive members. There was also Annette Mujukizi. Now, after that, that is the East African part. We are also having the West Africa Association of Physician Associates, led by the Vice President of Gacopa, who is the President of that association. They have been organizing. Last week, they went to Burkina Faso, where they realized that there are clinical officers in Burkina Faso. And they've been neglected. So they are working hand in hand using the West African chapter of Gacopa and the WAPA to bring that region into one and also fight for that harmonization, as even as the Gacopa International work on this internationally. We all know about the pomp and color as we launched the website and for the Malaysia conference, we want to talk about now. Talking about the Gacopa affiliate associations and regional chapters, he will talk about the East Africa at that time. He will get to know where the leadership of the East Africa are, and they held their first conference. Now, let's talk about these associations that work together with Gacopa. In summary, in Kenya, we have the Kenya Clinical Officers Association, we have the Kenya Union of Clinical Officers, and we also have different associations where we also have the president here of Ophthalmic Clinical and Cataract Surgery Association. He will also have his time and he will talk. But Kenya, the basic training for clinical officers started after high school and takes 4 years. Remember, Kenya has almost 30,000 plus clinical officers, and the origin for this cadre in Kenya, however, dates back in 1888 when Sir William Mackinnon, the first baronet, founded the Imperial British East African Company, was granted the royal charter to run the East African Protectorate, now Kenya. So in 1901, Kenyatta National Hospital was established by then Native Civil Hospital and later renamed King George VI. The European hospital, presently called the Nairobi Hospital, was to serve the European. So it started there, and the services to establish the first formal training program for clinical officers at Kenyatta National Hospital began in 1928. And we have the Kenya Clinical Officers Association, which is a professional society body established in 1962 and formally registered under the Societies Act. Its main objective and functions are supplementary and complementary to health care building, and they do a lot. When we are done with Kenya, we also have presence. The clinical officers' presence in Botswana. It's now 4 years old, and that is where we are taking our conference. We're taking our conference to Botswana because we really want to engage these upcoming countries where our profession is still not developed. So we are taking it to Botswana, and the Botswana Clinical Officers Union, registered under Wiapo, who is the president. We will finalize as we end this show, when we'll be talking about the Botswana conference. Then we also have clinical officers in Zambia, where my good friend, the President Neba Jones and Joseph Kamfua, Zambia clinical officers have got, we have the clinical officers general, we have the clinical officers psychiatry, and we have also the clinical officers who are called the clinical, the medical licentiate, where those who have done their degree. And also clinical officers of Zimbabwe, we've talked about that. We have clinical officers in Malawi, and PAUM being the registered trade union representing the clinical associates, officers and medical assistants. PAUM forms the backbone of the clinical services in Malawi, representing 85% of clinical staff. The president is Solomon Chomba, who is a member of Gacopa. And if we will talk more about, we also have the Ethiopia Health Officers Association. They told us more about them. The Ethiopian Public Health Officers Training Program was started in Ethiopia in 1954 in the then Gonda Public Health and Training Center. The training was interrupted due to issues of military, but again, it was restarted in 73 and then 95. But now, since the establishment of the association and developed a strategy of plans, the current year 2023-2025, they have really evolved, and they've been organizing annual conferences in Ethiopia. Dr. Serkelem is the president of that Ethiopia Clinical Officers, Ethiopia Public Health Association. Then we have the GPA of Ghana, where their objectives are to bring all the physician assistants in Ghana. They work with the GRAPAG together there in Ghana. So the Ghana physician assistant, I've talked about that, the GPA. So something that I forgot to mention is the Graduate Physician Assistant Association of Ghana. The president is Anthony Asariako. We also have the Medical Clinical Officers Professions of Uganda. And we have the Kenya Union of Clinical Officers. which is a registered trade union whose membership is open to all clinical officers. The chairman is Peterson Washira, and George Gibore is the secretary general. We go to Papua New Guinea. The Papua New Guinea have got the health extension officers trained with a bachelor's of health science in rural health. The study program is provided by one of the universities in Papua New Guinea, the Divine Word University. The program, which focuses upon preparation for clinical and administrative practices in the rural areas of Papua New Guinea, where health services are at most times neglected. The 4-year training program is a 4-year training program, and Papua New Guinea Health Extension Association is led by Maluo Maguru, is the country, is the registered national association. We also have the IFPACs working with Gacopa, International Federation of Physician Assistant, Physician Associate, and Clinical Officer Associate Comparable. It's a united group of healthcare students across the globe, and it's the world's most unique student-run organization. It represents, connects, and engages every day with students from comparable professions around the world, including physician assistant, physician associate, clinical officers, medical associates, medical assistants. This global body, they are really doing so well. We have the Professional Association of Clinical Associates in South Africa, and it stands as a representative body for the clinical associates. And I'm rallying upon the clinical associates from South Africa to come in large numbers in Botswana. We need to discuss. We need to discuss a lot in Botswana. Johannesburg is not far from Gaborone, and you really need to come in large numbers. We know the challenges that you are facing in South Africa when it comes to issues of professional growth, career progression. Of course, the quality of training is good, and we need PACASA, which represent the public interest and is a great advocate for the clinical associates there, to partner with Gacopa so that we make the recognition of the clinical associates in South Africa. We have the Physician Assistant for Global Health. This is one of the organizations that partnered with Gacopa when Gacopa was being formed. The leadership is led by Lindsay Milkarek as the president. At one time, our Gacopa president is the honorary board member of that organization, and its mission is to promote and support domestic and international global health activities of PAs and PA students. They support Gacopa. They are having the annual AAPA conference this month in May, where they will also have time. Then the Physician Assistant Education Association, that's the PAEA in the US, is the only national organization representing PA educational programs in the US. It works to ensure quality PA education through the development and distribution of education. The association was founded in 1972, and those are associations that work with Gacopa. Malaysian Association of Medical Assistants, very serious, a very big association. When we went to Malaysia, visited their offices, led by Alhaj Mustafa Majid. His association was initiated by a group of medical assistants in General Hospital Kuala Lumpur. Remember, Malaysia has close to more than 20,000 medical assistants or assistant medical officers. It was registered by the Registrar of Society. Malaysia, similarly, is like Kenya. They also have a union, and they have a board. We have the Faculty of Physician Associates in the United Kingdom. And this Faculty of Physician Associates, remember, there was that uproar, and what was happening, even those who follow, the Physician Associates program has now been accredited by the General Medical Council of UK. And we really thank the Physician Associates of UK for pushing for that. It has been long overdue, more than 20 years, fighting for recognition. And now, finally, they can be licensed. As Gacopa, we will work with them and ensure how some of our members from other countries can also join, study, and work there as physician associates. The faculty provides support to both qualified and student physician associates in their education. We have the Society of Community Health Technologists and Scientists of Nigeria. They are just like the clinical officers physician, but now the name, because that is what we are pushing for as Gacopa, to have a common name. Ephraim Awudu is the president. David Olusegun is the deputy president. We have the Burundi Clinical Officers Association, doing well, led by Colombe Bizurumeni and the vice and the members of the East Africa, Gacopa East Africa chapter. He will talk about that. Same as the Rwanda Medical Clinical Officers Organization. We had a conference in Rwanda, and the president is Dan Witonze. We have the Clinical Medicine Organization of Zanzibar. We also have the South Sudan Association of Clinical Officers. They have not been registered fully, but news that I got there 2 weeks ago is that they are in the final stages of being registered. And Michael Atem who was the acting president, together with the team there. I think things will be good there. The clinical officers in South Sudan are more than 3,000, and they play a critical role in the new country. You know, South Sudan is the newest kid on the block. So Liberia National Physician Assistant Association, led by Theophilus Fire and Bill O. Hanres as the Secretary General. These are founding members, founding association with Gacopa, and they've been together with Gacopa. We have the Afro PHC and the African Network of Clinical Practitioners, led by Honorable Albert Chaiti. So, very many things that we can say about Gacopa, but because of time, our main thing here was the fourth Gacopa International Delegates and Scientific Conference, where I had read that first statement, and what we'll be talking about is preparation for the conference. What I've just talked about is a summary about Gacopa, the journey, how it started, members. I have not mentioned there are several stakeholders. There are several members that we partner with, and there are very many organizations. Just before we move to the next stage, we also want to acknowledge the support from Clinician Circle. Clinician Circle is the only circle for the clinical officers and physician associates here in Kenya, and that circle is just for our welfare, and we need all the clinical officers. It is now open to the East Africa clinical officers, so if you are a member of, if you really want to join the circle, you can join it online, and he's a board member. He will talk about that circle at that time. So I've just given a summary of what is Gacopa, how it started, where we are heading to, and we want to say that we've done a lot. We're just putting our structures in place, but we will start officially our registration drive when we'll be holding our conference in Botswana. So members, those who will register for the conference in Botswana, part of the registration fee will be for official registration, and you'll be given registration certificates. Those who will attend virtually, you'll also get those registration certificates. We want to have we are revamping our website, and we will communicate. We will always be having this type of shows or this type of updates, maybe monthly, so that we put our members in an active way to know about what Gacopa is. So I want to give this chance to the Vice Chair of Gacopa East Africa, because we are in Kenya, we are in Nairobi, and it will not be good if we just talk about the global part of it from top, and then we don't talk about the East African chapter, and that is the Gacopa East Africa. Then from there, we will give he's going to talk about ophthalmology and cataract surgery in Africa and Kenya, and their struggles and how they are pushing to have that registration both in Kenya and in Africa. And I'm very sure for those who are watching us here, there are very many ophthalmic clinical officers and cataract surgeons, very many. From Malawi, they do a lot of surgeries. Zambia, we even have, I met even some in Burundi. So this is the time here that we have your interim leadership. They are here, and they are also supporting Gacopa. They'll be in Botswana. So without wasting time, I will want the Vice Chairman of Gacopa East Africa to just give a brief and summary about the East African chapter. Thank you.
Thank you so much, Mr. President, for quite an elaborate work. Actually, he's given us the history and the progress of Gacopa. I'll talk about the Gacopa East Africa chapter. My name is Godfrey Ndungu, clinical officer currently based in Kenya. I'm the first vice chairperson of Gacopa East Africa. Just a brief how Gacopa East Africa was formed. Gacopa East Africa was formed after the South African Legislative Assembly whereby a team from Gacopa International Executive was tasked to form. And what we know at the East African level, we have more than 80,000 clinical officers spread across member countries, that is Ethiopia, Kenya, Uganda, Tanzania, Rwanda, Burundi, South Sudan, and Somaliland. With different chapters of Gacopa formed to enhance penetration, sensitization, and effective management of Gacopa activities, the East Africa chapter became the first entity of Gacopa to register as a chapter, whereby our head office of the East African chapter is in Uganda. And back then, a robust team led by Alex Kachwano, Paul Kiaterekera, Mebra Kakazi, and Joseph Hashaya, they facilitated the registration with the following elected on interim basis as officials. The Advisory Council, this is the leadership, the interim leadership. The Advisory Council is Austin Oduor, is the president. We have Crispin Onditi. We have Annette Namugosa. We have Viola Mujikuzi. We have Ken Ochogia. We have Rhoda Akoth. We have the late Aziza Yusuf, may her soul rest in peace. We have Paul Katerekera. And last but not the least is Alex Kachwano. And the interim executive committee members, we had the chairman was Ngendukumana Jean Claude from Burundi. And the first vice chairperson was Gobo George David from South Sudan. The second vice chairperson was Innocent Somboi, this is from Tanzania. And the third vice chairperson was John Mutia Mutua from Kenya. And the fourth vice chairperson was Habimana Antonie from Rwanda. The Secretary General was and currently is Hashaya Joseph from Uganda. And we have the deputy. We have three deputies of the SD. For the activity, we have Elizabeth Marco from Tanzania. The interim deputy general membership and external affairs was Shakrin Karani from Kenya. And the deputy general from the capacity building was Michael Atem from South Sudan. Our treasurer was Mebra Kakazi from Uganda. And the deputy treasurer was Said Mohammed Mwanafumo from Tanzania. The gender secretary, we have Colombe Bizumuire from Burundi. And the deputy gender secretary was Deborah Akelo from Kenya. And we have the specialist representative. This was Fitsum Taye from Ethiopia. And the publicity officer was Ronald Nyamamba, this from Kenya. And we had the general coordinator committee, we had John Otieno Nyango from Kenya. Now, the East Africa chapter, we held our first East African conference in Zanzibar. This was between March 3rd and 4th in 2023. And the theme of the conference was the impact of clinical officers in universal health coverage. The event took place at the State University of Zanzibar, the Mahorube Conference Hall, whereby the guest of honor was none other than the President of Zanzibar, His Excellency Dr. Hussein Ali Mwinyi. The Gacopa East Africa chapter partnered with the Ministry of Health Zanzibar, the State University of Zanzibar, and the Zanzibar School of Health to enable the conference to take place. And we want to thank our partners. One of them is Biopharma. It's a giant manufacturing company in Kenya. We also have PharmaCan and etc. etc. These companies, they partnered with the Gacopa to facilitate and ensure that the conference took place. The best thing, we have our president on board. He made several visits prior to the conference with his team and to make sure the success of the conference. And it is from that conference whereby the current leadership was elected, whereby we have our chairperson from Ethiopia, and we have three vice chairpersons. I am the first vice chairperson from Kenya, Tanzania, and Rwanda, also from Burundi. And we have the other executive. One of the key things that we discussed during the conference, and it is one of the tasks that we are given. One of the tasks is harmonization of the training and curriculum in the East African chapter. I'll just go briefly with what we had. We had a first East African Clinical Officer Harmonization workshop, and it took place in Kigali at Lebanon Hotel. That is from 29th of February to 1st of March 2024. I'm just going to give a brief summary with the resolution that was set. And the best thing is the process went so well. And just let me give just a brief history. So, the inaugural East African Council, the inaugural East Africa Clinical Officers Harmonization Council workshop, was held from 29th February to 1st of March 2024 in Kigali, Rwanda. And it marked a very significant milestone in the journey towards harmonization of healthcare practices across the region. Our hosts were the Rwanda Allied Health Professional Council, this is RHAPC, in collaboration with Gacopa, East African Association, and also the Rwanda Medical Association and Clinical Officers Organization, this is RMCOO. And this workshop, it aligned with the directives of the 23rd Ordinary Meeting of the East African Committee Sectoral Council of Ministers on Health, which was held on 10th of February 2023 in Burundi. At the forefront of the workshop's agenda was the urgent need to address the shortage of healthcare providers by establishing a standardized training and practice guidelines for clinical officers throughout the EAC, the member states of EAC. And this initiative is aimed to improve the healthcare quality and consistency by equipping clinical officers with not only standardized skills, but also to bridge the existing gaps and alleviate the workforce shortage. The workshop, it fostered collaboration among key stakeholders, including a representative from the Ministry of Health, regulatory bodies, professional associations and unions, universities, and other health professional representatives from across the East African countries. Through the robust discussions and knowledge exchange, participants formulated resolutions and established a joint steering committee, which was tasked to lead the standardization and harmonization of clinical officers training and practice across the East Africa, whereby Rwanda played a vital role at the forefront. So, I just read the objectives with permission from the President. The main objective of the harmonization workshop was to advance the standardization and the quality of clinical officers training programs across East Africa. And this is in line with the agenda of Gacopa and also in line with the WHO guidelines, whereby we try to harmonize our practice across the globe. Now, the specific objectives, we had 4. I'll just read through. One was to harmonize training program, and this is to conduct a thorough review of the standardized clinical officer training curriculum to ensure alignment with regional standards, and also to establish a designated task force to oversee the implementation of recommended curriculum updates until ratified. Objective number 2 was to facilitate knowledge and experience sharing, whereby we were to organize interactive sessions to encourage the exchange of diverse knowledge and experiences among clinical officer stakeholders from EAC member states. Also to foster discussions that promote innovative best practices and address individual country challenges, aiming to formulate standards that transcend diverse contexts and contribute to optimal healthcare quality. The third specific objective was to develop regional harmonization roadmap. Now, here was to utilize the joint discussion results among the EAC member states to create comprehensive regional harmonization roadmap, emphasize effective practices that can be uniformly implemented across East Africa, enhancing the overall quality of clinical officer training, practice, and ensuring consistency in standards. And fourth objective was design and implement process and standards. And here we were to collaborate to design and implement common process standards for clinical officers practices. This including the review of mutual recognition agreement and the 7 distinct standards in training practice. And these standards serve as vital benchmarks in shaping the framework for the education, professional activities for clinical officers in the region. Through detailed exploration of these standards, we identify the areas of improvement, address the challenges, and contribute to the development of a robust and tailored approach to the training and practice of clinical officers in the South African context. Now, in summary, let me just read the resolution, the workshop resolutions, and these were presented to the EAC, whereby it was signed, and we're just waiting for the member states, the ministers, to adopt. One of the resolution was the EAC member countries, they have agreed to harmonize the training and practice of clinical officers, clinical practitioners in EAC member states, whereby Rwanda was spearheading the process. Number 2 was the member countries, they formed a joint steering committee to coordinate the process of harmonization. The joint steering committee constitute the subcommittees on curriculum, inspection checklist, and regulations nomenclature by March 15th, year Peter, and the joint steering committee to engage all key stakeholders and must have submitted the final draft to the East African Clinical Harmonization team. And also, the validation meeting shall take place on May, subject to the calendar of EAC, Sectoral Council meeting ministers of health. The final report shall be presented to the health ministers of respective member states. And last but not the least was the respective regulatory bodies shall be responsible for the coordination of standardization and harmonization of clinical officers training and practice. Now, these resolutions, they were approved by the head of delegation from respective countries and the absence of Tanzania, South Sudan, and the Democratic Republic of Congo. And they were presented at the EAC office, whereby we are just awaiting for the adoption of the same so that it can be presented to the member states. Mine is just to urge our members, let us stand together in this journey in making sure Gacopa and making sure the clinical officers, the physician assistants and associates, and all analogs across the globe, we stand to be counted in accordance to the WHO guidelines and also with what we believe in. So back to you, Mr. President. Thank you so much.
Thank you so much, the Vice Chair of the Gacopa East Africa, and we are remaining with rightfully 4 minutes to go. I will give the chance to the ophthalmology and cataract surgery president.
Thank you. My name is Ekisa Ambuchi. I am the interim president of the National Association of Comprehensive Ophthalmology and Cataract Surgeons, that is NACOP, here in Kenya. Briefly, it's important to understand what is National Association of Comprehensive Ophthalmology Practitioners. This is an association awaiting its full registration that comprises of members who are allied to Gacopa. These are specialized eye doctor, eye physicians that basically deals with the eyes and its disease across the country. This association was brought in conception basically a year ago, following the introduction of this program, the Bachelor of Science in Comprehensive Ophthalmology and Cataract Surgery. This program is basically done at the Jomo Kenyatta University of Science and Technology here in Kenya, Juja. The program was started in Kenya in 2016, 2017. This was as a result of a research, a randomized research that was done that elicited that we have an enormous shortage of eye healthcare workers across the globe. And the few who are there are essentially stationed in urban centers, rendering the almost 60% of Kenyans in the villages inaccessible in eye healthcare. So following this research, there was an initiative by the government and the stakeholders to introduce a course that will provide human resource to handle this dire need of shortage of healthcare workers. So this course was initiated in 2017, and also in the research it was shown that apart from the ophthalmologist, these are the doctors who have done masters in ophthalmologists. We have OCOs, ophthalmic clinical officers, who are initially clinical officers and have done national higher diploma in ophthalmology and cataract surgery, were the one who were offering comprehensive eye care within the community. So some of the recommendations from the research was that we can train the ophthalmic clinical officers a little bit more detailed and offer them the best resources to offer comprehensive ophthalmic care to Kenyans in the villages. This started in 2017, as I have alluded, and our first graduate came out in 2020. As at January this year, the University of JKUAT, Jomo Kenyatta University of Science and Technology, have already produced around 100 comprehensive ophthalmologists. Allow me to take you through how the birth of a comprehensive ophthalmology is. For you to be enrolled in this program, first you must be having a basic general knowledge in clinical medicine. One, that means you must have a diploma in clinical medicine, or you must be having a higher national diploma in comprehensive ophthalmology and cataract surgery. Also, you also are eligible to do this program if you have a degree in clinical medicine and surgery. This program is a 4-year program and a one-year internship program. So what happens is that after having these requests for joining this program, it's enabled in JKUAT Kenya Juja, and also in conjunction with the Sabati Eye Hospital, which is situated in western region of this country, Kenya. It's a big eye hospital that has served the whole region and even the whole country as far as ophthalmic care is concerned. So this program is growing big, and we encourage clinical officers around Africa who are eligible, and even across the board. They can present their basic education to the relevant university for assessment, and upon approval, they can get entry to pursue this wonderful program and join forces to offer specialized and highly comprehensive ophthalmic care to citizens, not only in this country, but across the globe. On matters Gacopa, we are affiliate to Gacopa, and we have walked the journey together. We understand as a young association that the power to practice ophthalmology must go global. That's the reason why we are truly affiliated to Gacopa, so that we can link with our friends globally and share knowledge and share opportunity to further our education on further subspecialty as far as the field of ophthalmology is concerned. We are determined as an association to send more of our members in Botswana in our conference that shall be happening in August. We are looking forward to meet our colleagues there across the world, so we can exchange ideas and challenges and foster a formidable force that will handle the issues and the challenges of eye care. I also wish to admit that we're in the process of legally registering this association for the purpose of ensuring career progression as far as its members are concerned, and that after that we will work closely to Gacopa and even the Kenya Clinical Association to ensure that we actually progress positively as far as career development is concerned. So we say that come August, let's meet in Botswana for the purpose of our fourth international conference. Thank you very much.
Thank you so much, Mr. President. You know, ophthalmology is a very key part in the clinical medicine or clinical officers' career progression. I've seen some of our colleagues from Zambia following us live. You'll get more about the comprehensive ophthalmology in our social media pages, WhatsApp. We will engage. Your President, Joseph Kamfwa, will update you people. Some of you from Zambia can come and train in Kenya. Now, we want to finalize. And how are we finalizing this now? We've talked about Gacopa. More about Gacopa. There are a lot of things about Gacopa that we can say here, but because of time, we've done introduction about Gacopa, how it started, where we are heading to, affiliate associations. We've tried to bring the affiliate association heads here. They've talked about the East African chapter. He's talked about the comprehensive ophthalmology. Of course, there are very many. We have the anesthetist, we have the dermatology, but we couldn't get them because of time. Our final issue that we are now discussing is Botswana. And as I stated earlier, we are preparing a concept note. That concept note will be shared on social media, on our Facebook page, on our YouTube, on our websites, and also on the WhatsApp. And it will be shared with relevant leaders. Now, apart from the people from West Africa, the people from Asia, the people from Europe, and the people from South America and America, those who will be traveling to Botswana, they love to use air transport. But for the people within East Africa and Southern Africa who wants to attend this beautiful conference, you have asked several times about the update. How can we make it to Botswana, if not by air? We really want to travel by road. Now, it is very possible to travel to South Africa by bus. And you know, when I talk of South Africa, I talk about Botswana, because Botswana and South Africa, initially, it used to be one country together with Namibia. But now, it is very close. From Gaborone to Johannesburg is very close. It's 4 hours. So I will give you the route to Johannesburg, and of course, from Johannesburg, you will take that 4-hour trip to Gaborone. If I tell you that we are going to Gaborone, the air ticket from Gaborone return is close to $1,000. If you're going to South Africa, it's around $800, $700. By road, it's a bit easy. You will take 3 different buses to travel from Nairobi to South Africa. I'm now talking on behalf of people from Kampala, people from Uganda, people from South Sudan, people from Kenya, and people from Tanzania, because from Nairobi we'll be heading to Dar es Salaam. You can travel with Tamid coach, Kidia 1, or classic coaches. You'll take you to Dar es Salaam. Now, bus 2 from Dar es Salaam to Lusaka, Zambia, the reliable bus company operating on the route is Classic Coaches. The last data we have was 2 weeks ago. They have daily schedule from Dar es Salaam to Lusaka. So you'll not have that point. You'll get that bus. It's a very comfortable bus. It leaves from Dar es Salaam to Lusaka. Mostly it's around 50 US dollars or 40 US dollars, but it's not that expensive. Now, once you are in Lusaka, you'll get a third bus. The third bus will leave Lusaka to Johannesburg, and we have several bus companies operating on the route: Royal Africa Logistics, K and M Luxury, Unlimited Gift Limited, and Juldan Motors. They don't operate daily. Buses depart to South Africa from Zambia on Sundays and Tuesdays. So look at when the conference will begin, plan yourself. Sundays and Tuesdays, we have buses from Lusaka to Johannesburg. Kenyans and Ugandans usually face a very tough time at the Tunduma-Nakonde border point. And why are we saying that? That's the border separating Tanzania and Zambia. The officials there are very mean and will harass you if you are not from Tanzania or Zambia. So if you travel in a group and you have all the required documents, it will be easy: yellow fever, passport, international passport, not temporary passport. Those wishing to go to Lilongwe in Malawi by bus, we have Falcon coaches which depart Dar es Salaam to Lilongwe every Wednesday. And of course, there are also other buses. But when you go to Lilongwe, make sure you will now catch up with the team of Malawi led by Solomon Chomba, who have hired buses. So if you can book with them early, you leave Dar es Salaam to Lilongwe, catch up with Solomon Chomba, who have got buses who will leave Lilongwe to Gaborone and back to Lilongwe. So that will be an easier one for those people who will want to go through Malawi. We will share the contacts of Solomon Chomba. If you want to see the Victoria Falls, remember the classic as a direct bus from Dar es Salaam to Harare, Zimbabwe and Lubumbashi. So you can also try Ratco Express. They have direct bus too. If you want to see the Victoria Falls, try Royal Africa Logistics. They use the Zimbabwe route while heading to South Africa from Zambia, and the road they usually pass near the Victoria Falls. Requirements for traveling: everything required during a cross-border travel: have a visa. No visa now for Kenyans, Ugandans, South Sudan. You don't need a visa to travel to those countries, but you need to have a valid international passport. Total cost for traveling alone from Kenya is usually roughly around 23,000. That's traveling without accommodation and food. So what we will still engage with different bus companies for those who want to direct trip, for those who want short trip, but I know of colleagues who are also having their own vehicles and they want to travel down south. Otherwise, more of these logistics we will issue, and even the accommodation in Botswana when that time reaches. We had planned to have this show for only 1 hour. My colleagues, comrades, the time is up. We've tried our best. We've given it all. We will be having such another show in a month's time, and that time we will be giving you more updates, and we will now be telling you now, we'll now already even know the people who will be traveling to Botswana, and we'll be coordinating. And the coordinator is here with me for the East Africans. The coordinator is Godfrey Ndumu, the vice chair. He will be traveling by road. He will travel with you people. We will be attending the graduation of the DDT College of Medicine in June, mid-June, and we will go with him and other officials so that we prepare the road for this huge conference that will take place in Gaborone. And the guest of honor will be the President of Botswana, Honorable Masisi. And we are happy that the Ministry of Health and the government of Botswana has endorsed this conference. So all systems are ready to organize, to have this international conference, the first of its kind in Southern Africa. Otherwise, with those many remarks, we started with a press conference by the Association